Hi everyone, my name is Isabela Ortiz Caso, and this is my presentation for the first program at William & Mary. Before I begin, I'd like to acknowledge my research advisor, Dr. ADRIAN J. Bravo, and express my gratitude to the Charles Center for funding this project under the Glauber Fellowship. I decided to focus on long COVID and its impact on reported health and immune function, and this is across national analysis across 6 different countries. So, a little bit of background. As we know, COVID-19 has had a profound impact on populations worldwide, particularly on general health and immune function. College students were especially vulnerable, facing multiple disruptions to their education, like going virtually, mental health challenges, and changes to their daily routines. Large in part because of restrictions like lockdowns and social distancing measures varied significantly across countries as the pandemic progressed. Students worldwide were left dealing with varying levels of economic instability and extended periods of isolation, which further affected their physical and mental health. For example, in Argentina, the world's longest lockdown took place there and it lasted 150 days, as well as one of Europe's strictest lockdowns was enforced in Spain. So we can see that drastic difference between what's being enforced and how long it lasts. So this brings us to the central question of my research, which is how does self-reported immune function and general health differ among college students across 6 countries who were infected with COVID compared to those who were not? Our goal was to examine the self-reported general health and immune function of college students during the pandemic. Specifically, we were interested in exploring the effects of COVID infection and post-infection illness, which is now known as long COVID. The study was conducted online across colleges in the 6 different countries in the US, Spain, Argentina, South Africa, England, and Canada between March 2022 and July 2023. Our sample size consisted of 4,411 college students, most of whom were female, as well as we examined key variables such as self-reported health and immune function through the ISQ, the immune status questionnaire, COVID-19 infection status, illness severity, and country-specific factors like vaccination availability, when did vaccination start rolling out, as well as infection rates. Our results show that participants who were infected with COVID reported significantly lower immune functions scores across those who were not. Among those infected, students who reported feeling sick due to COVID had even lower immune function scores. Additionally, COVID infection effects on the immune function was consistent across all 6 countries, though the effect sizes were relatively small. However, some countries, such as the US, I'd like to note that reported higher immune function compared to developing countries such as South Africa and Argentina. So currently, our results align with our current understanding of long COVID. Long COVID is a condition characterized by persistent symptoms lasting weeks, months, or even years post-COVID infection, which can severely affect students' self-reported immune function. Moreover, these findings suggest that tailored health interventions, including mental health support, are crucial, particularly in the countries where students reported lower immune function. And given the heightened vulnerability of college students, coupled with our findings reporting lower immune function post-COVID infection, it suggests a general need for more individualized, preventative-focused public health strategies. So in conclusion, our studies highlight the significant impact of COVID-19 has had on college students' health across the 6 countries that we examined. Thank you to Dr. Adrian J. Bravo, the Charles Center, and the Glauber Fellowship for supporting this research, and I appreciate your attention.